So what I really want to talk about is biotoxin testing, and why this is important and when it's not important, because it's not always necessary to do a lot of fancy tests. Like I showed you with the VCS test, super simple, super easy. You do it at home. It doesn't require a blood draw. You don't even have to pee into a cup. So that's one that I think is really valuable. But let's just go through this a little bit. If you feel free to interrupt me at any time. But I first test that I want to talk about is our new roadmap score. So everybody that was invited to this got an invitation to take this roadmap. If you didn't do it, we're going to give it to you when we send you the replay. And this is a new tool that I devised to identify those hidden causes that are still hanging out there. So basically it's a lot of questions, 77 questions or something like that. But once you take it, it's actually going to give you an overall score for your health. Red, not so good. Orange, pretty good. Green, really good. So this unfortunate person, who's a person that I talked to just the other day, when she took this evaluation, we're going to look at all of the systems. So she had a lot of musculoskeletal system issues, hormonal issues, and autoimmune issues. So all of those are in the red. When something's in the red, it's screaming, let's do something about this now. This is not the time to wait. In the orange, it's like this is a problem that's going to become a bigger problem unless we do something about it. And if it's in the green, it's yay, you're lucky. So I encourage everybody to take this. It's different than the roadmap you've been taking. And we still use that one too, because really this is almost like a screening test where the other one is showing me actually system by system improvements. So we will make sure you get the link to this. Feel free to share it with friends. So if you have somebody that you're like, let's see how'd you do, dude? Send it off to them and they'll get emailed the results. And then if they want to talk to one of us, including Dave or Victoria, about their results, they've actually been specially trained to go through and help people understand what these results are all about. So the other test we already talked about a little bit. So that's the VCS test. So this is a vision test, but it doesn't test your ability to see. It's not an acuity test. It tests your ability to see contrast. This test was actually developed by the military, and they use it for fighter pilots. So the reason they started doing that is because it was cheap, non-invasive, and they could say, hey, dude, how you doing today? So let's say a pilot was on shore leave and had had a really good time, had a few too many cocktails the day before, they would actually test their VCS test, or if they got a head injury, or if they had a cold or a flu, because all of those things will affect this. The biggest thing, though, that we know affects this is molds more than other toxins, but molds is the biggie. Other toxins do show up here too. So a lot of times if I'm getting somebody almost there, but we can't get them over the hump, then we do a heavy metals test or something else, and that will pop up and show me what we've been missing. So like we talked about, we do both eyes separately. And as you can see, this person's right eye was much better even from the get-go, but the left eye was really bad. And we know who this is now, right? So she just told you by 10 o'clock in the morning, she would lose vision in her left eye. That's so scary when you're not even 40, right? That's a problem. So this is an easy and cheap test. You can get it on the Got Mold website. I prefer that one to the other one. And let me just make sure that nobody's out there. Eileen, can you go check and make sure that Laura Balsas doesn't want to come into this room? I hope you can do that. Next thing is hidden infections. So we talked a little bit about this. Mold and or Lyme is definitely one of them. Problem with Lyme is that the testing isn't that good. So a plain old, do I have Lyme or do I not have Lyme? That test is about 45% accurate. So you're better off flipping a coin. Let's see. Maybe she got kicked out. Let's see. Sorry, I just want to make sure I'm not excluding anybody. So there are other tests that we can do. Western blot test, much more accurate, probably about 65 to 75% accurate, especially in the acute phase. And then in the more chronic phase, we actually have these kind of fancy Lyme tests, eye spot. There's a couple others, and they're expensive. They're a couple $1,000s. But if we're concerned and we think that's a problem, especially if you're from an endemic area, then we can definitely do that kind of testing. Other things we looked at, Epstein-Barr virus. Does everybody remember EBV? That's mono. Okay, that was the kissing disease when we were in high school. Most of us have had it at some point in time. And we carry those antibodies forever. Just like when we had the chicken pox, we don't, get the chicken pox again. We don't really get Epstein-Barr virus again either, but it can actually become what's called reactivated. So we can actually see that the antibodies for that acute illness go up, even if somebody had it months ago or years ago. So I don't see it all the time, but most people will come to me from somebody else having had that testing, and then we'll look at it. It's not something I find super helpful because it just gives you a label, right? So I have reactivated Epstein-Barr virus. I don't have a treatment for it. We're going to treat it just like we treat everything else. We're going to improve your immune system. We're going to improve your nutrition. We're going to get your body working the way it's supposed to. And then your immune system will naturally suppress it back down where it belongs. Other thing is a parasite test. So parasitology is really fascinating. Parasites have a very complex life cycle. So they start as a little bitty egg. That's usually how we consume them. So we can consume them in the egg phase. It is always a fecal oral route, which means it comes from some poop somewhere and ends up in our mouth now, or nose, or eyes. And it's often from fresh water. So parasites come in, they're a little egg, they get some warm, happy place in your tummy, and then they decide to come out of the egg phase, they go into a bigger phase, and then they actually can turn into flukes and worms and all sorts of stuff. Now, my naturopathic friends tell me that if we're alive, we have parasites. I believe them. We don't always have them in our gut because they like to leave the gut and travel to other places. And so the stool testing isn't always super accurate. And if you go to your regular doctor and you think you have a parasite, they actually need to do 5 stool samples to determine that parasitology. So they send 5 days in a row, and then they look at them under a microscope. But they're only looking under a microscope, and they're looking for the ova, the eggs, or the actual parasite that's in there. The testing that we tend to do tends to be more PCR based. So it's actually based on the DNA. So every parasite, every bacteria, we all have different DNA, and we can actually determine whether that parasite is present from that GI map or stool study. Sometimes we'll just treat. If I have a high suspicion, one of the things I think about when I think of parasites is flares of symptoms. So if you find that you have a flare of your symptoms, so your body aches, your headache, your fatigue, and it's around the full moon, you have parasites because they like the full moon. They're very ancient creatures. So that is if you know somebody who's like, I always get a fever one time in the month, and it's not a female around their period, then that's something to consider. So I'm really just telling you that so you can have the education. If we need to get rid of them, we can. Heavy metals testing. So heavy metals testing is sneaky too. Lead is the one we always think of because we test all our kids for it, right? We found out that lead in car gasoline and lead in paint was bad for your IQ. Actually will lower a kid's IQ 20 to 40 points. That's a lot. That's from, genius to barely functioning if you go a whole 40 points. So heavy metals are important, and especially with a lot of stuff coming to us from overseas. Not that I think America's a whole lot better, but we don't know what's in there. A lot of supplements have been found to have heavy metals in them. So some people that are actually trying to do something really good for themselves, but they're ordering their stuff from Amazon and we don't really know where it came from, it actually has metals in it, and that they're neurotoxins. and they get into your brain, your liver, your kidneys, but really it's the nerves that are the most affected. So when we get stuck with somebody we know has mold, but they're not getting all the way better, then we start diving into the heavy metals. You can do a urine test for that. Some people do a hair test. I'm not so convinced that the hair test is that accurate. So I tend to use urine testing when we do heavy metals. Sometimes if we think that it's not so bad, we might actually give you something, a chelator, to pull them out, and then you pee in the cup, and then we can see more of them. There are blood tests too. That tends to work much better for acute exposures. So not something that has been kind of gradual over time. This is kind of the most fun one for me. This is the MARCoNS swab. So this is a nasal swab. It's kind of like a COVID test. You get a little Q-tip, you stick it up your nose on both sides, you stick it in the thing, and they send it back. MARCoNS is a special type of staph infection. And it's not even really an infection. It's more like I'm really happy living in the warm, hot, wet space of your nasal cavities. And it causes a couple of things. It causes low MSH. MSH is melanocyte stimulating hormone. All the hormones, remember, talk to each other. So if one hormone's low, it's going to affect the information from all the other hormones. So that's something I always like to consider. MSH is when it's in normal levels, it's anti-inflammatory. When it's in low levels, it actually increases inflammation. So we want that MSH level to be high. It affects, like I said, a lot of other hormones, including something called VIP, which is vasopressin. Vasopressin actually causes our arteries to constrict when we stand up so we don't fall down like Harlan used to do. So that's one of the problems that causes that postural orthostatic tachycardia or passing out when you stand up is low MSH levels. If you have MARCoNS in your sinuses, your MSH level will always be low, and it will not come up until we fix the MARCoNS. So I see this mostly in people who've had kind of chronic sinusitis, chronic seasonal allergies. Every time they get cold with a cold, they get a sinus infection, and then they get put on antibiotics, and then we wreck their gut, even though the antibiotics don't do a very good job of getting to the sinuses. So I think this is a really, really important test. Also not terribly expensive. Eden or Island can probably correct me, but I think it's about $100. It also will show if there's any other bacteria in there. And I've had a run lately of really not good bacteria that shouldn't be in your sinus cavities, like E. coli and Klebsiella, which we associate with UTIs and colon infections. There's also sometimes we find mold in there. So you're actually auto-producing your own mold. It might not be in your house. So I think that that's a really worthy test for most people to get, especially if they've had sinus stuff. Other things that we look at, and I won't go into too much detail with these, but complements, C3A, C4A, these are kind of measures of your immune system activation, underactivation, or overactivation. TGF-beta1, which indicates inflammation and immune response. MMP9, which really reflects tissue damage. So this is a cool test. When MMP9 is really high, that means your cells aren't getting enough blood flow. Is that a problem? Yeah. If our cells aren't getting enough blood flow, how can they possibly do what we want them to do? So when the MMP9 is super high, that inflammation from the biotoxins, that is telling me that the blood flow is diminished, and that's really, really common in chronic fatigue patients. We see that all the time. VIP, I mentioned a minute ago. It is a vasoactive intestinal polypeptide, and we see brain fog and fatigue. That's the biggest thing. And then that kind of standing up and falling down thing as well. So we need to fix all of those processes in order to get somebody healed and really well. So I just want to say, if you recognize yourself in any of these descriptions or somebody you love or you know, then let's talk about the testing. We'll get the right stuff. We'll get it done in the right way. We don't want to do it too fast, but we got to work through the process. So that's all I have to say about this.